All right, it's Saturday night. We're going to talk about sealants. Here we go. We have our etch, we have our prime and bond, we have our sealant syringe. Um, all of that is set up on our bracket tray cover there. We have our little micro brushes there and our cotton pliers. We isolate the upper teeth with the dry angles, as Tammy has nicely demonstrated. We use cotton rolls, and they're held in place with our cotton roll holders right here on the bracket tray cover. There's our Profi paste, our instrumentation. Dr. Culp would always need a clean pair of cotton forceps to grab burrs as he needs them throughout the process. And this tray is set up beautifully. So let's get busy. We have a willing subject here. He is in need of a few EP seals. We're going to start off with using our brush Profi angle. This is different from our cup Profi angle, of course, because it does indeed have bristles, and we find that it gets down into the grooves and cleans the plaque out of the grooves quite well. So that's what I'm doing here. I'm demonstrating that. I believe Braden has selected the bubblegum flavored toothpaste, which he prefers. There we go. There's a close up of the brush. And once clean, we're going to rinse and get all the extra Profi paste out of there. I prefer to use the slow speed for this process. There we are. So a good rinse, making sure that all the Profi paste is out of there. Quick close of the lips. And the water is evacuated nicely. Very good. There we go. Perfect. Very nice. Next, we're going to check and make sure that our teeth are totally clean. And we mentioned that these are EP seals, which stands for enamelplasty. We need to just lightly polish away some of the stains in the grooves, and I'm using the cotton roll holder for the lower left side there. You can see the handpiece in my hand there. We're going to just lightly polish the top part of that tooth. Tammy has a high speed evacuation, which is important, and we are now cleaning the grooves there. Once we clean, we're going to rinse, dry, and we're going to check it. So the assistant hands the mirror over. We're going to check it like that, and then we're also going to check it and make sure that the tooth is indeed sound. It looks like that one is. Cotton roll holder comes out. Very good. We changed the cotton rolls because they were saturated with saliva and we're ready to actually perform the sealant. We take a cotton ball, which has been saturated with 37% phosphoric acid, and we etch the surface for 40 seconds. Tammy has just activated the timer, which you can see back on the counter. And when it emits the alarm, and 40 seconds have gone by, once they have, then we're going to rinse and dry the tooth. Here we are. There's actually an application of Prime and Bond used first dried, and then the application of the sealant material, which this video does not depict, and that's okay. We small detail here, we can fix that later, but the main point is made. So we check the placement with our mirror, then we bring our flashlight over, and we will cure the material correctly with the aid of our blue light. Once the material is cured, or at least initially cured, we will continue on the way. Take the cotton roll holder out. Let's give Braden a big drink of water because we all know that the oxygen inhibited layer of the sealant is not very tasty. And he's a happy camper. Very good.